Let's discuss the topic of medical imaging in the emergency room. For radiographers, trauma imaging can both be stressful and chaotic. Remember, this is a different environment from the controlled environment in the medical imaging department. The role of a healthcare worker in an emergency environment is to recognize urgent medical conditions and minimize pain and trauma. In the emergency room, there is a shortage of experienced staff, and this can lead to longer wait times for patients. Some patients may wait hours before receiving care, which can have serious consequences. Efforts are being made to address this shortage, but it remains a significant challenge. For medical staff, their expertise that they gain in training or school makes up only about 20 to 25% of the skill set that they need for working in a trauma emergency environment. Further experience, knowledge, and continuing medical education enhances the healthcare professional providers' skill sets. It is critical that physicians, nurses, and hospital administrators understand the serious health consequences and increased costs that can and do result from the lack of knowledge in utilizing medical imaging modalities appropriately in the emergency room. On the average, level 1 teaching hospitals typically see 150 to 230 patients per 24-hour day in the emergency room. These hospitals play a crucial role as gatekeepers for hospital admissions, which are approximately 74,000 patients, representing about 70% of the 106,000 patients admitted to the hospital each day. In the United States, level 3 and level 4 hospitals vary in size and patient volume. Let's break down some relevant statistics. Level 3 hospitals are typically community hospitals that provide a broad range of service but may not have specialized capabilities like a level 1 or a level 2 trauma center. On the average, level 3 hospitals see around 150 to 230 patients per day in the emergency room. Keep in mind that this number can fluctuate based on location, population density, and other factors. Level 4 hospitals are often smaller and serve rural or underserved areas. While there isn't a specific national average for level 4 hospitals, they tend to have lower patient volumes compared to larger facilities. Remember, there is no one-size-fits-all solution, and hospitals should tailor their approaches based on their unique context and challenges. By implementing these strategies, ERs can enhance patient care, reduce wait times, and improve overall performance. The hospital or facility should consider changes to practice and process, such as optimizing care transitions and leveraging technology. Working in a trauma emergency room can be rewarding and challenging, especially for the inexperienced staff. So let's explore some aspects of working in the ER environment. Inexperienced staff may find it emotionally draining to witness traumatic events, handle critical patients, and make rapid decisions. Chronic work-related stress can lead to emotional exhaustion, burnout, and even physical health issues. There is an emotional impact on healthcare workers who interact with patients who have experienced trauma, such as accidents, violence, or life-threatening illnesses. Inexperienced staff may benefit from mentorship and guidance to navigate the emotional demands of trauma care. Trauma imaging presents several challenges that radiologists and radiographers must navigate to provide accurate and timely diagnostic images. Trauma cases often require urgent imaging to identify life-threatening injuries promptly. The radiographer needs to balance the need for rapid imaging with maintaining diagnostic accuracy, which is crucial. Delays in imaging can impact patient outcomes. Trauma patients may be unstable, in pain, or unable to cooperate fully during imaging, and the radiologist must adapt to patient-specific limitations while interpreting the images that have become necessary to provide diagnostic information to the attending physicians. For any imaging in the emergency department, communication with the emergency room staff and other specialists is essential. Trauma involves a wide range of injuries, from fractures to internal bleeding. Interpreting complex anatomical structures, for example, brain, spine, chest, and abdomen, accurately is very demanding. Differentiating acute injuries from pre-existing conditions can also be very tricky. To work effectively in the emergency room as a radiographer, you need to have critical thinking skills and the ability to identify a good quality image. You also must be able to adapt and fix a repairable or a bad image, which means you have to have a solid understanding of exposure, positioning, and a knowledge of why the images are being taken. This means using common sense. You must also understand the role of the radiographer on the ET team is different than the role of the radiographer in medical imaging. With trauma, you never know what or who will come in next. It's often difficult to get caught up in the chaos of the emergency room, but for radiographers, you must realize that the majority of patients that are going into the emergency room are routine type patients, and only 30% or less are actually urgent patients that need to be addressed immediately. Taking a look at those patients that need to be prioritized, we see that the majority of them would be urgent, minor trauma, and major trauma. Radiographers working in trauma need to display speed, accuracy, quality in their imaging, the ability to position patients traditionally, and create new images and positioning based upon the tube, region of interest, and detector proximity. And finally, they need to understand immobilization techniques, especially on patients that are not routine, quote-unquote, walkie-talkies. Take a moment and look at this image of a patient in the emergency room. What do you see that seems odd? Take a look at the feet. An experienced radiographer that has worked in trauma for many years will tell you, obviously, the patient has a broken hip. With this knowledge, you'll be able to anticipate what will be required to image this patient in this situation. Radiographers often have the ability to correct images that are not perfect in exposure but are good working images. Remember, bad practice still translates into bad images. Just for fun, let's take a look at this image to the left. What you see here is a patient that was not positioned correctly for a swimmer's view, and the exposure ended up being way overexposed, which burned out all of the tissue. And do you see any detail in the C7-T1 junction? No. The patient needs to be redone. You cannot save this image. But there are many times that you can save an image by simply post-processing some of the data. It is imperative to get a good image by proper patient positioning, proper beam collimation or restriction, utilizing proper exposure factors, and one of the big problems is incorrect ID of the patient and incorrect marking of the images, which can cause confusion, especially later on. Say the patient goes to surgery and they need to have an amputation of the left foot and it's marked right foot. Guess what? There's a problem. Trauma radiography presents several challenges due to the urgent and often critical nature of trauma cases. Let's explore some of these challenges. The primary challenge for trauma radiographers is to obtain high-quality diagnostic images on the first attempt, especially when patients are unable to move into the desired position. Trauma patients may be in pain, disoriented, or physically restricted due to their injuries, making positioning challenging. And often the trauma radiographer needs to be able to create a non-traditional working radiograph to show the area of interest. Radiographers must work efficiently to capture essential views without causing additional discomfort or harm to the patient. In emergency departments, portable X-ray equipment is often used for trauma imaging. These machines have limitations compared to fixed radiography, such as lower image quality and limited positioning options. Radiographers must optimize technique, settings, and positioning to compensate for these limitations. Understanding and operating specialized imaging equipment designed for trauma patients is crucial. This includes the knowledge of portable X-ray machines, mobile CT scanners, and ultrasound devices. Radiographers play an essential role in the emergency team. They need to have effective communication and be able to collaborate and adapt to whatever is necessary to work seamlessly with the physicians, nurses, and other healthcare professionals. In summary, trauma radiography requires a combination of technical skill, adaptability, and compassion. Radiographers who choose to work in this challenging environment contribute significantly to patient care during critical moments. The radiographer must be able to quickly assess the patient's condition, stabilize any life-threatening injuries, and address immediate needs. They have to be able to explain the imaging procedure to the patient and address any of the patient's concerns or fears, and obtain informed consent if necessary. Let's take a moment to look at some of the challenges that happen in the emergency department when using medical imaging. Remember that prompt and accurate diagnosis along with appropriate management can significantly impact patient outcomes. Standards for trauma radiology emphasize the importance of diagnostic imaging and interventional radiology in managing severely injured patients. As imaging technology has evolved and become more sophisticated, so has emergency care. This includes changes in the role of image acquisition that now allow many times a physician bedside to perform point-of-care ultrasound, in addition to the radiographic or medical imaging. Portable X-ray exams are widely used for initial assessment of trauma patients. They provide quick images of bones and can detect fractures, dislocations, and foreign bodies. The difficulty with this is the use of ionizing radiation, which sometimes is not understood by other healthcare professionals and patients, making them wary of the portable X-ray exam. Computed tomography is also used for trauma patients. CT scans can provide detailed cross-sectional images of the body, and they are valuable for assessing both bone and soft tissue injuries. One of the problems with the use of CT is the number of CT scans available and the time it takes to image the patient. Being able to prioritize and triage the patients correctly to effectively utilize this scan is critical. In ER, CT scans are primarily used for head trauma, abdominal trauma, and spinal injuries. Ultrasound is portable and readily available, and it provides real-time images without radiation exposure and can be performed by the ER physician. For the radiographer, improving your positioning skills in trauma radiography is essential for obtaining high-quality diagnostic images. Trauma images often differ from routine imaging in the medical imaging department, and we need what are called working images, which demonstrate the area of interest for the physician that is working on the patient. These are in addition to the traditional protocols that are used to demonstrate the anatomy. To be able to create these working images, the radiographer must have a good knowledge of anatomy and pathology, mastering positioning and understanding the geometry of tube-part receptor alignment to create working images that demonstrate information about the region of interest that may not be a routine projection. Patients coming into the emergency room are triaged. Triage is a method of prioritizing the treatment of patients and allocating resources. A Category 1 patient is a priority and they need immediate care. These patients require immediate, life-saving intervention. Examples include severe bleeding, compromised airway, or critical injuries that demand urgent attention. The level 2 category for triaging is the patient has a moderate bleeding. They might include fractures or injuries that are serious but not immediately life-threatening. Most patients going through triage actually fall into Category 3. Category 3 is delayed care, and its patients in this category require medical treatment, but it can be safely delayed. Examples include minor injuries, stable fractures, or non-urgent medical conditions. There is a level 4 in triage known as Code Black. Code Black is a patient who is deceased or has injuries so extensive that survival is not possible with the available resources. The radiographer very often does not interact with these type of patients. The golden hour. Of those victims of major trauma who die, 2/3 will have suffered major head or other central nervous system injuries about which little could have been done and that would have altered the inevitable outcome. However, 2/3 of the remaining fatalities would be preventable if the casualty were to receive appropriate medical management within the golden hour. In other words, rapidly. The longer you take to diagnose and treat a patient, the lower their survival rate. So what an RT should know is how to avoid additional harm to the patient, obtain appropriate medical assistance quickly, recognize emergency situations, and remain calm and confident. Patients and their family and friends lack the knowledge to assess technical quality care that they are receiving. Typically, their quality judgment is based entirely on their subjective experiences throughout the emergency room process. However, do they know if an exam is good or bad? Often patients request exams that have been seen on TV or other media, and the physician may or may not comply with this request to keep them happy. This practice necessitates the measurement and assurance of both quality components of the exam and the necessity for exams ordered in an emergency department. Beyond technical skill, healthcare professionals must have interpersonal skills to provide a positive patient experience. Remember, each one of our patients is unique, and not only that, each one of our healthcare providers is unique. So we must focus on the ability to communicate between the healthcare provider and the patient. Lastly, let's not forget the skills that are needed, which are basic: how a radiograph image is made, how good image quality elements are created, and the effects of incorrect X-ray exposure selection and image quality, and the effects of patient positioning. Thanks for your attention.